This presentation will be on high-altitude acclimation and the effects that can cause in the body when going up to high altitudes. Now, when you are doing a sport such as skiing or any type of high-risk sport that's in the mountains, that's at a high altitude, you are putting your body at many risks because you have to give yourself time to adjust. And there are extreme sports that mainly occur in high acclimation areas. So when you are doing these sports, you have to make sure that your body can adjust before you take any type of risk. Risks that you can take can be such as when your temperature in the colder areas increases, you can potentially have frostbite or hypothermia, which is really dangerous and can lead to death. Today's conclusion is basically that when people participate in physical activities at high altitude, they become more prone to be tired and out of breath. And the most occurrences that occur are headaches and nausea, which are symptomatic symptoms at elevations of 3,000 meters. And the purpose of this presentation is to make awareness towards the situations that when you are going to high altitude maladies, there are a lot of things that you should take note of before you're doing these activities. Two of the main sources I will be talking about are illnesses, which are acute mountain sickness and high-altitude pulmonary edema, which commonly occurs among people who travel at high altitudes and are in the cold weather. This project will basically make more importance of the situation that we have to have proper acclimation and take note of this because you will be putting your body at serious risks that are maybe prone to either developing higher diseases that are more chronic than acute and making your body more prone to have to fight more because you're not actually taking the proper precautions. This is a brief slide that I included, which is Breckenridge, Colorado, which is a ski resort, and this elevation is 9,000 feet above sea level, and the elevation of the resort reaches 12,998 feet, which is very dangerous. And people want to visit this, or the people who does visit this, they are experiencing a lot of body changes throughout the period of time because they haven't really properly adjusted to this. So in this PowerPoint, I included many high altitude North American cities, and the highest one was Denver, Colorado. And as you can see, this is the city, and that background includes mountains with high elevations of 5,208 feet, which is the highest mountain that is in Denver, Colorado. Now let's talk about the health causations associated with high altitude acclimation. We have chronic mountain sickness. And chronic mountain sickness is a disease that the amount of blood proportion volume that is usually encapsulated by red blood cells start to majorly increase, which results in polycythemia, which is basically many blood cells, and it will lead to an abnormally count, which could be considered as when your oxygen level starts to decrease and stuff, it would be considered as hypoxemia, but in this case it's either hyperpolysemia or polycythemia. Now, the symptoms can include many variety, such as your sleep disorders, headaches, dizziness, and you can have cognitive impairment, which are the main symptoms that you can see. This diagram to the left, it just basically shows you the outlook of what this chronic mountain sickness will result in. The next disorder we have is hypoxia, and hypoxia is an absence of not having enough oxygen, while it says hypo. Hypo is the prefix of below, and as you can see, it's below oxygen levels, which are abnormal. And basically in the body tissues, they have to maintain our normal daily lives of bodily functions, which is why we need enough oxygen intake. So now the symptoms would include a headache, weakening of the pulse, shortness of breath. You may be confused and you will have a fast beating, accelerated heart rate, and then you will have a bluish color to the skin, fingernails, and lips. Now we have acute mountain sickness, which is the effect of our health, which you are exposed to a high altitude, which causes low amount of oxygen levels because you are starting to intake. Now, your symptoms are basically just like hypoxia, but you will include heavy breathing, hallucinations, headache, nausea, dizziness, and an upset stomach. Now, these are common symptoms that we may experience on a day-to-day basis, but if you're going out to the mountains at a high elevation and you are okay and then you're experiencing this, you have to associate this with one of these sicknesses. So now we have high-altitude cerebral edema, which refers to HACE, and it is a disease that the brain starts to swell with cerebral fluid because of the effects of acclimating to a high altitude, meaning that when we are traveling and we're going up high, our brain has a lot of pressure, which the fluid can increase, which may cause either brain damage or it may cause, even worst case scenario, death when it's too much pressure on the brain, because our brain can take only but that much. Now, the symptoms will make you tired. You will have ataxia, an altered mental status, fever, rapid heartbeat. These are main common symptoms that we can get from ourselves and experience that something's wrong. And then when you have a headache as well, which is one of the symptoms, because you have all this fluid buildup, so your head might be pounding. So now we have pulmonary edema, which is known as HAPE, and it is a disease that causes increased pressure, which comes from the constriction of our lungs. Now, it eventually starts to leak out our fluid from the blood vessels, such as the capillaries, into the lung tissues, which is highly dangerous because it starts to go to the air sacs, which can make us intake blood into our oxygens, which that really does not mix. And this is worst case scenario, a live or die moment, because if we're breathing in blood with our oxygen, this is going to cause a lot of failures within our body system. Now, symptoms include a dry cough, shortness of breath, frequent headaches, decreased mobility when exercising, and you have a bluish color to your lips, cold, clammy skin, and a regular rapid heartbeat, which are kind of like the same of the last diseases being discussed, but it has more of a heavy impact. Now, we do have common treatments of these diseases and disorders. So the treatments for chronic mountain sickness is over-the-counter medicine. Benefits us because that medicine causes that increase the blood flow back into the normal standards, involving a lower heart rate because we had polycythemia with the chronic mountain sickness. So this medicine helps balances that our heart rate back out. Now, HYPOXIA, you have to avoid secondhand smoking and you have to seek medical treatment. Just like acute mountain sickness, you need pain medication, which could take up to 3 days with taking it to stop the acute mountain sickness because it's only short term. Now, we do have high-altitude cerebral edema. We have to take medications for that, and the medications help if you're already associated with the acute mountain sickness. Now, if you want to be your own doctor, you can get ibuprofen, which is recommended by the history of medicine for this chronic disease. Now, including with the high-altitude cerebral edema, you have to make sure that you don't take just anything, and you make sure you get treated accordingly if your symptoms worsen. And high-altitude pulmonary edema, you have to seek medical attention because you might have to receive a 500 milligram dosage of Diamox in portable hyperbaric chambers. This is actually a higher risk to do on your own, and you have to make sure that you take the proper tools. This slide is my references and links, and in this case, I used a whole bunch of references and links. And And I also wanted to include my poster I did for PERC, which is the Altitude Acclimation Overview. And if you would like to view it, you can see my blog at North America Rocks. And this is also the QR code on the right hand of the poster that you can also see my blog. But this is my presentation on altitude acclimation, and I will hope y'all gained as much as awareness as anyone else would. And y'all have a great day.